Welcome, everyone. We're so happy you're here to our medication management for caregivers and seniors class. We want to welcome Gavin Gardner. We're so excited to have him here. He is a pharmacist with Intermountain Healthcare. He's been a pharmacist for over 10 years, and he works at the Spanish Fork Hospital. He's very knowledgeable and has lots of great information for us. So thank you for being here, Gavin. We appreciate you. And we will turn the time over to you, and we'll do our questions and answers at the end.
Perfect. Well, thank you. Um, my screen doesn't show me the slides. Are you all able to see the little slideshow presentation? Okay. Well, let's get started. Like Tanya said, my name is Gavin Gardner. I've been a pharmacist with Intermountain for 10 years. I started at McCady Hospital and was then at Heber Valley Hospital, and now I'm here at Spanish Fork Hospital. So I've kind of made my way south. I work mainly on the inpatient side of things, so I take care of patients as they come into the hospital. So some of the tips and tricks I'll share with you today will be um, what can help prepare you for maybe a trip to the hospital or whatnot. And I'm here on the hospital floor right now, so we might have some distractions. I apologize for that, but we'll do our best to keep those limited. Let's see. I'll get over here to my slides now. So as we talk about medication safety, this is both for caregivers and for patients. I wanted to just kind of introduce my why to you, why I'm a pharmacist and why I do what I do. The picture on the left is my family, my wife and 4 kids. I love them to death, and they're what keep me motivated on a day-to-day basis. And then the picture on the right is my grandma, Louise Gardner. She's one of the reasons I got into pharmacy. She had a number of health issues throughout her life. And as I guess I was probably junior high school, and starting to kind of try to know where I wanted to go with my career and with my life. And she had a number of drug interactions and drug complications from her medications. And so, as you can imagine, that was not fun to deal with. And so she had quite a few problems with that. And so that kind of motivates me still to this day to really try to help, keep people safe. I don't usually cry in presentations, but when it's about someone you love, um, I'll quickly move on here. So as we talk about medication safety, there's a few points I really want to point out. And that is, as the most important thing we can do is prevent medication errors. After it's happened, there's things that we can do and actions we can take, but the most important thing is to prevent errors from happening. As we look at managing those medications on a daily basis, we're going to go into more detail about that. And I would encourage everyone, as you communicate with healthcare professionals, to really try and take notes, keep track of what you're going through. And sometimes it's really hard to recount back what conversations you've had. So if you have it in writing, it's so much easier to reflect back on and know what was talked about and what plan of action needs to take place. And then I think it's so important to recognize as caregivers that there needs to be support for you as well, not just the patient or the individual that we're all caring for. So as we look at medication management, there's lots of challenges with that. But when we ensure that we are using our medication safely, it really does reduce errors, and it reduces the problems that we see on a regular basis. Not only do we want to prevent medication errors, but we also want to improve adherence. If we're going to be using these medications, it's so important for us to make sure that we are taking them appropriately to get the best benefit from them. There's no reason to increase risk if we're not going to get any kind of benefit. So medications, they always talk about practicing medicine, at least doctors do, right? They practice medicine, and it's really just a balance of of risk versus benefit. And so utilize your healthcare team, utilize your pharmacist, your doctors to really to find that balance with the medication regimen that you and your loved ones are using. And then we're going to talk a little bit more about some drug interactions as well. So some of the common challenges that we really face as complex regimens. Working here in the hospital, I see patients come in all the time with 5, 10, 15, even 20 medications that they're taking all at one time. And that can be a huge challenge. Those medications, 5 of them might be white circular tablets that all look just the same, but they have just little different imprints on them. And so it's important to kind of keep track of what those medications are. And especially when there's so many changes with our medications, that can be really challenging. And then, I myself, I take a number of medications for a disease state that I have. And sometimes my routine is so similar each and every day. I'll get to 9 o'clock in the morning and I'll ask myself, did I take my medications? So if you look at the picture there on the left, that's a tool I use. It's just a little medication organizer, and once I've taken it out of Monday morning, I know I've taken my medications, because there's been so many times I've looked back and said, did I take it or did I not? And so trying to find a way to stay organized is very important. So there's different things we can do. Making sure you're consistent with your medications. A lot of medications it's important that you take them at the same time each day to get the best benefit and to have the safety that medication is providing for you. An example of that is like an anticoagulant, Eliquis or Xarelto, something that's preventing blood clots. It's important to take those on a regular basis at the same time each day. Just a small example is that Xarelto should be taken with a meal, usually in the evening. But if that's not the case, you've worked something else out with your doctor or your pharmacist. Just being consistent is important. Pill organizers and visual aids are important. I've got some pictures on the next slide that I'll show. And then, utilizing technology, whether that's your phone or other devices to remind you and help you remember to take your medications. And then the last thing on there is maintaining medication lists. This is kind of a shout out for me. It makes my job easier in the hospital, but if you have a current medication list with you when you come into the hospital, it's so much easier for us to quickly get you taken care of. Sometimes, if you're coming into the hospital, you might not be able to communicate with us. You might not be able to remember all the medications you are taking. But if you do have a list, that allows us to look at what medications you should be taking and helps our doctors make clinical decisions based off of those, and help take the best care of you as possible. This slide here's a couple different examples of pill organizers that I've seen used that are very successful. The pill packs there on the left. Some pharmacies will do that for you. And if not, that's actually, you can order those just right on Amazon, and you can organize your own family members' medications that way. You can see it goes, Sunday through Saturday, in the morning, noon, evening, and bedtime. It just really helps know which medications you've taken, and is a great tool. I think an even better tool is this picture on the right. And this is when I was in pharmacy school, I worked for a pharmacy, and we utilized this program, this technology. And so each time of day had its own little pack. It's about 2 inches by 2 inches. And you can kind of see there on the far right, it kind of comes in a strip, almost like a fruit roll up. You just kind of unroll it as you go throughout the day and break off each individual pack. And you can see there on this bigger picture here that it's got the patient's name, what the product is, when you should be taking it. This one even has a direction. The glyburide says to take with meal. You've got the size, the color of the tablet, and that way, if maybe you're taking like a diuretic, a water pill like furosemide, uh, and the doctor wants you to hold that for a couple of days, you can easily identify which one of those tablets it is and remove that from those packs. Usually, when they utilize these packs, they don't put controlled substances in those, so you'd have to have those separate. But it's a really great tool, and you can just rip it off as you go throughout the day and take the medications. And I know there are some pharmacies here in Utah County that do these systems and have this technology and this program. So if that's something that could help you or your loved one, that would be definitely something to look into. Um, it's important to avoid dangerous drug mix-ups. This is another reason I think it's important to have a good updated list of your medications with you. I'm sure, I think it's safe to say we've all encountered insurance companies and how hard they are to deal with sometimes. And what I mean by that is sometimes they want you to use mail order pharmacy. Sometimes you're going to utilize your local community pharmacy. And sometimes those lists don't cross over. So if you have a list with you, you can hand that to your community pharmacist and say, hey, this is what I get from mail order. Does this new medication interact with anything that I'm taking? Because they can only compare with what they have access to, and so that's another reason to have a good updated list with you at all times. If possible, I would recommend just using one pharmacy. Sometimes there's going to be differences to that, whether that's mail order. Sometimes your insurance requires you to use like a specialty pharmacy. Um, and that can be frustrating. But if, again, at all possible, just using one pharmacy really improves their ability to take care of you and your loved one. Up here at the top of the slide, it's important to always read the instructions. Uh, Unfortunately, humans do make mistakes, and that includes healthcare providers. And so I have seen and luckily have caught situations where instead of a 10 milligram tablet, a 20 milligram tablet was prescribed for whatever reason. And it's important to make those catches, and just if you're able to compare those to a list that you already have, you'll be able to know that you're still taking the correct medications. If something looks off to you, in the hospital, we have a little slogan that we say, stop and resolve. If a new tablet's a different color, if something looks different, be confident and don't worry about challenging the doctor or challenging the pharmacist. You need to step up and say something. Okay. Feel free to stop and resolve and make sure that you're getting the answers you need before you proceed, because we definitely would not want something to happen. Sometimes different manufacturers have different color tablets and so forth, so that is possible, but likely there could be a mistake have been made, and we wouldn't want anything to happen to you or your loved one. I have a little note on there too to keep your original containers. If you're using those pill packs or different organizational tools, still keep those old containers until you've utilized everything that was in them. That way you have something to refer back to if you have questions or concerns. Again, this picture kind of depicts, the balancing act of medicine. There's lots of interactions out there. I thought about giving some specific ones here today, but I thought it might just be better to just talk about some of the things that you should look out for, especially if you're feeling dizzy or unusual fatigue, mental changes. Those are things that you can bring up with your doctor. I don't know. I know within Intermountain, we just switched to a new electronic health system called Epic. And within there's a My Health app. And within that app, it makes it so easy for caregivers and patients to actually reach out to your doctors. You can go in there and message them. And I've seen on the caregiver side, or I guess on the healthcare provider side, I can see some of those notes and I can see how easy it is for the doctor to respond. You know, I'm feeling dizzy. I've just increased this dose of a blood pressure medication. The dizziness has not resolved. You said it might last a couple of days, but it's been a week and it's still going on. What should I do? And instead of having to come into the doctor and make a whole trip and a visit, a simple message like that is possible. And so utilize that technology the best you can. And it's a great tool, a great resource. Um, and I would always, whenever you're getting a new prescription, I would always ask the pharmacist if it's going to interact with anything that you're currently taking. And again, another caveat to have an active list of your medications with you always. So some of those key questions that you could ask is, what is this medication for? How should I be taking this medication? Any side effects I should look out for. Usually with each medication, and as they taught us in pharmacy school, there's probably 2, 3, maybe 4 side effects that are known to happen with a medication, but then there's probably 37 other ones that could happen. So when you ask the pharmacist, they're going to be able to identify those key ones, but there's going to be many others, and that's something that the pharmacist might have to take a little bit more time to look into and try to help you with. But they utilize technology and they'll utilize their resources to help find those interactions, even if they don't happen too often, but they are there. And, make sure that you're just asking questions and utilizing those healthcare workers because that's their job. I know I enjoy answering questions. If I'm just going through my daily tasks, all day, every day, it gets kind of boring. I enjoy talking with the patients, talking with the caregivers, and trying to help in those situations. Again, just a few strategies for success with your medications, using written schedules, checklists, logs, whatever you can do, being really engaged and asking questions, really getting to know your caregivers, your pharmacists. That's another really good reason to use the same pharmacy. Just be able to create that relationship and be able to know who you're asking questions to. Sorry, I jumped ahead there. There we go. Sorry. And then as you continue to do that, your confidence will grow and you'll be able to help take care of those that you love. This was one thing that I think is really important when we talk about medications. Sometimes we have leftover medications. Or what are we supposed to do with that? Are we supposed to throw them in the trash? Are we supposed to flush them down the toilet? What are we supposed to do? Well, here are a few links, and we'll be able to provide these for you away from the slides as well. But there's the Utah Valley Drug Prevention Coalition, and they've got on their website, they've got locations around Utah Valley that you're able to dispose of medications, and that's controlled substances and non-controlled substances. We really don't want a bunch of medications flushed down the toilet because we just don't want that in our water system, our water supply. And so there are proper ways to get rid of all those medications. If you're not in Utah County, I found another website, unwantedmeds.org. On there, you can also find drop-off locations to get rid of those medications. Unfortunately, some medications can be abused, right? So those medications, as I think a lot of us don't like to waste, a lot of us want to be prepared for the unknown, but it is important to get rid of those medications that can be abused. Some of those controlled substances or narcotics should be disposed of properly if you're not actively using those. Sadly enough, family members, other people might abuse them, and you might be tempted to abuse them yourself. And so it's important to get rid of those if you're not actively using them. So, if anything, these are the takeaways I hope you got at least these are things that I think are most important. We talked about stopping and resolving. If something looks off, speak up, asking questions, um, up to date medication list, and then I would just share again how important it is to look at caregiver burnout. In the hospital, something I learned very early in my education was how hard it is for caregivers to take care of patients. Um, I One of my rotations for school was actually in downtown Chicago at Northwestern Memorial Hospital, and I was part of the neuro ICU. So we were taking care of some really sick patients. And when I was there, I saw the best and the worst of all mankind. I saw some very, very diligent and helpful family members that were trying to take care of their patients. I saw some that were exhausting themselves to no end trying to help their family. They loved them so much. But what's important to recognize is that, oh, my alarm went off. I apologize. What's important to identify is that when you're a caregiver for a patient, there's a whole team of people trying to help take care of that patient. And hopefully you've got some support and help at home, but there's doctors and pharmacists and nurses and social workers, and there's a whole team of people caring for that individual. And there's not always that big a group taking care of you as a caregiver. So make sure that you take the time to take care of yourself and look for those resources and branch out and ask for help. Um, People are always willing to help, and it's important to make sure you take care of yourself because there's so many challenges. And like I said, when I was in Chicago for that rotation, I saw so many people getting burnt out. And the thing was, is there was literally 20, 30 people taking care of the patient, but it's important for that, the caregiver to also get the rest and the help that they need. And I believe that is it. Um, what questions can I answer for any of you?
Thank you so much, Gavin. We appreciate you and your presentation. That was great.